Hello everyone! Today we have a video about urinary tract infections. 4 common questions answered today for you. Question number 1. Do cranberries help reduce the occurrence of urinary tract infections? The answer? Why, yes they do. Cranberry juice and cranberry tablets have shown to reduce the occurrence of UTIs. Essentially, it prevents the bacteria from sticking to the bladder wall, and it makes the urine more acidic. And when you say acidic, it basically is making an undesirable environment for the bacteria to live. Bacteria that tend to cause UTIs don't like to live in acidic conditions. Cranberries also contain, and I'll put the word here, Proanthocyanidins. This is a chemical compound in cranberries that actually gives it its red color. It has illustrated a potent bacterial anti-adhesion activity. Basically what all that mumbo jumbo means, then it's less likely for the bacteria to stick to the wall of the bladder. What bacteria is most often the cause for UTIs? If you guessed E. coli, you are correct. There are other bacteria that can cause UTIs. A few included are here. Of course, we have the E. coli, but also Pseudomonas and also the Proteus, mirabilis as well. One very important topic to discuss upon briefly, catheter-associated urinary tract infections. These are the most common type of nosocomial infections, and according to eMedicine/Medscape, Proteus and Pseudomonas species are actually some of the most commonly associated with the biofilm that grows on the catheters. Candida, especially Candida albicans, is actually the second most common organism that can cause catheter-associated urinary tract infections. There are obviously more bacteria other than just these that we've mentioned that can cause urinary tract infections, and different groups are at increased risk for different kinds of bacteria. This is why we send cultures out after we do a urinalysis. We do this because we want to find the antibiotic that's going to fit the best or be the most sensitive to the bacteria that we are facing. In other words, we want to pick the antibiotic that's going to actually work. Next question. Why do men get UTIs less than women? The simple answer is that the urethra is actually longer in males. The urethra is the tube that carries the urine out from the bladder. When one has a shorter tube, such as in the instance of women, it's easier for the bacteria on the outside to travel up to the bladder. In addition, a woman's urethral opening is much closer to the two main sources of bacteria from the outside. This includes the vagina and anus. Something that's important to note is that women get UTIs up to 30 times more often than men do. And as many as 4 in 10 women who get a UTI will get at least one more within 6 months. Next question. Why do older women get UTIs more often? The simple answer is the loss of estrogen after menopause. After women go through menopause, estrogen obviously decreases. Estrogen protects the vaginal tissue. Less estrogen causes the vaginal tissue to do something called atrophy. What this means basically is that the tissue in the vaginal area becomes thinner, drier, less elastic, and less flexible. This makes it a lot easier for harmful bacteria to grow, and thus this would explain why older women tend to get more urinary tract infections. That's it for this video today. Thank you so much for watching. Please make sure to subscribe, hit that notification bell, and also give this video a thumbs up if you like these kind of videos. And we'll see you next time.